Fine. Hello. My name's Victor Inyang, Medical Director, East Anglian Air Ambulance.
Hi everybody, I'm Pam Chrispin and I'm Deputy Medical Director at East Anglian Air Ambulance.
Hi guys, nice to speak to you all. I'm Neil Berry. I'm a consultant with East Anglian Air Ambulance.
Hi everybody, my name's Abilius. I'm one of the East Anglia Air Ambulance doctor and also a specialist registrar in emergency medicine working up in Hull.
It's great. Well, we're really here to talk about vaccines, and we've got some great questions that have been submitted by members of the public. So, Victor, I think you've got the first question.
Indeed, I have. So the first question is, how was the vaccine process managed for you?
So who's had their vaccine?
I've had my vaccine, and I was very pleased to get it. I had it at Ipswich. The process was set up quite nicely. I've actually worked in the vaccination clinic there as the medical cover and vaccinating people as well as alongside other things. It was a very easy booking. Attend what used to be our lecture theatre has now been turned into a kind of a 9-10 bedded vaccination clinic. It was a booking. Get a number, have your number called, all socially distanced and wearing masks. When I was called, I was met by a very friendly nurse, and it's a run through a quick medical history to check there's no contraindications to giving me the vaccine, which there are very few, and then the injection. 15 minutes of waiting around for any reaction, which again very, very rare, and then I was back to my normal work. The only problem I had was, the only side effect was an achy arm. And that's for about 24 hours. But other than that, nothing else for me.
Yeah, I also had my vaccine about a few weeks ago, so just after Christmas, actually, end of December. And I think the process is pretty much the same. And I think the vaccination process has been quite consistent from my personal experience across different areas, which is good to see that we are doing things in a consistent and high standard. And same experience as Neil personally. Go in, have the vaccine, wait 15 minutes after all the checks, and then went home. And my side effects it's quite mild, achy arm, and that's about it. And lasted about 24 hours.
I think Victor and I had ours at the same time, actually, didn't we?
Indeed.
We went to Peterborough for ours. Yeah. And the same, astonishingly slick process. I mean, it just makes you proud to be part of this healthcare system, doesn't it? It all felt really safe, really slick, really well monitored, well documented. I thought it was a fantastic process, really. And because Victor and I were doing our 15-minute wait at the same time, we could have the opportunity for a face-to-face but socially distanced chat, which was first time in ages. So it was a very positive process, I think.
I think positivity was like, I was surprised because there's not a lot of that around, to be honest. But I was surprised about my feelings when I actually got the jab. It was almost like, a little bit of a proud moment, almost a lump in the throat moment, because actually I felt when I had the jab, I thought, well, this is the answer. This is our way out of this mess, along with the social distancing and the lockdown and all that kind of stuff. But the vaccine is one of the answers, whereas up till that point, it feels like I've just been dealing with the problems with no real answers.
No, I agree, Neil. And as regards side effects, my only side effect was a slightly achy arm and just a little bit of lethargy the next day, which is probably just me. And then I was back to normal.
Yeah, I was the same. I just had a slightly achy arm, which I moaned about quite a lot. But I thought it was actually better than the flu jab. I normally have quite a severe response to my annual flu jab, and it was definitely better than that. So no problems at all. And haven't personally heard of anybody who has had more than that. I'm sure there are people who've had some more severe reactions, but I think it's pretty rare. So I think most people just had a bit of a sore arm.
Yeah.
Neil, I think you've got the next question.
Yeah, so to what extent does getting the population vaccinated get us back to what we consider normal life?
I think that's a great question, and I suppose it's defined normal life. I think the vaccine is, like you say, Neil, a way back to normal, but normal as we know it is probably a little way off. So I think it is good news, it is progress, but I still think in spite of the vaccine, we're going to have to, for a little while longer, actually be a bit more disciplined, you know, keep our hygiene going, keep our distance going, and just listen to the message from Public Health England. So we're getting there, but let's not rush in. Let's not spoil the great progress we're making.
I think that's an important message. I keep having the conversation with my 94-year-old grandma, who she keeps asking me, now she's had the vaccine, can she hug the grandchildren and can she go to Marks and Spencer's? And she asks me on a daily basis. And I tell her that actually the vaccine has changed nothing for you, Gran. We still have to socially distance. We still have to stay away. We're still in lockdown. We've still got to be super careful. It just may help us come out of this quicker and be there in the future. So it's a really important step, but in the short term, no real changes.
Yeah, I agree. I think talking from personal experience, obviously, I was born in Hong Kong, and Hong Kong went through SARS in 2003. Which was quite a significant event from a respiratory disease point of view. And I think, 16, 17 years on, people are gone back to normal, obviously, until the COVID-19 started. But then over time, over that period of time, people have changed their hygiene habits, and they're becoming a little bit more careful when they're ill. They start wearing masks if they got a cold, and just be mindful not to spread the disease, whatever they may be, and wash their hands a lot more, better discipline as well in their personal hygiene. I think it does change, but then I think the important thing is life does go back to normal eventually, but it requires some discipline, some patience, and some perseverance from the general public to follow the guidance and the rules.
I think that's a really great point. So I'm not sure I want things to go back to normal. Most people know that I was really quite ill at the end of 2019. And actually, personally, I've been really well this year, which has been an unusual year for me. So as somebody who's slightly at risk of repeatedly catching infections, to know that actually we're going to have better regimes for hand hygiene and so on is actually, I don't want to go back to the old normal. I want us to keep remaining vigilant and keeping those good hygiene practices. So yeah, a new normal, but I think we will get back to normal. Victor, I think you've got the next question, which is a really excellent question.
I do.
For the public.
I do. This is a great question, actually. Do you think the current timeline set for the number of vaccines a week is realistic?
Ha! So 10 million reached as we are doing this recording, which is amazing, I think. I don't know what other people think. 500,000 have had their second dose already as well. So it's been a really good effort so far.
I think that's impressive. I mean, whatever else you can comment on and about the running of the COVID incident, that the vaccine, 10 million, that's an impressive effort.
Yeah, I agree. I think looking at the initial sort of pledge of the top 4 most at risk category was, I think, 13 million of the population that are classified as the most at risk. By mid-February was our national target, and I think we are at the 4th day into February. We have just gone over 10 million. I think it's pretty impressive progress that we have made so far.
And I just checked how many vaccination centres there are. I think we've now got 200 hospital hubs, 50 vaccination centres around the country, and 1,200 local sites. So it's like the whole country is pulling together. So personally, I think it's realistic that we'll follow the schedule. Again, it just makes me really proud of the healthcare system in this country. Everybody's pulled together nearly. You've said you're giving some vaccines as well in your spare time, as it were. So I think it's pretty realistic. I think one of the things, and I've got a really good question now that's coming from somebody, is people are really worried about some of the potential effects of the vaccine. And one of the questions that's been asked is about whether the vaccine can affect fertility. I just wonder if anybody's got a good form of words to. We know that there's no evidence at the moment, but I just wonder if anybody's got a really good form of words to explain to people why they shouldn't be worried about having the vaccine in relation to fertility problems.
I think one of the things that has impressed me with the development of the vaccine, apart from it being innovative, and yes, it has happened very quickly, but the integrity, the science behind it, the people actually working on developing the vaccines have been our best scientists. And really, it is a credit to science in the UK and worldwide. So the integrity, to my mind, is without doubt. I know it's gone through a rigorous process of safety checks. I have no doubt. I have no doubt from family members to have the vaccine. When they get the call, I'll be saying to them, go and get your vaccine. I have no concerns about safety. The evidence, I'm happy the evidence is out there. It's good.
I agree. I think one of the things that's really important to try and get over to people is that there are some groups we just don't have the evidence for, because when you test new drugs or medicines, you tend to test it on the safe groups, if you like, first. So it would have been inappropriate to test the vaccine on people who are pregnant or who are worried or have fertility problems in the first place. So I think it's absence of evidence does not mean there's a problem. It just means we need to do more tests. So I think people need to be really reassured about the safety message.
It's an interesting one, fertility, as well, because over recent years, decades, fertility has been falling. And then no one's sure about why, and it's mainly in the Western world, why fertility rates are falling, whether it's to do with our diet or our lifestyles or all that kind of stuff. But yeah, I've seen no evidence that the vaccine causes anything.
There's a very strong statement from the Royal College of Obstetrician and Gynecology that that's been published recently. Thank you. AB, I think you've got the next question.
Yes. So here's the question. So the virus is often spoken about only in infections and fatalities. Is there information on rates of long-term effects for those who have had the virus and survived, and particularly in those under 50?
Yeah, that's a great question. And actually, AB, we were talking about that just before we started the call, certainly in what you're seeing in the ED. I think probably we should start by reassuring people that most people who have the illness of the virus actually make quite a good recovery and remain well. And there are a few people who then unfortunately have prolonged symptoms, the so-called long COVID, which is a complex mix of different symptoms. I don't know if you're going to raise some of the things you see in ED.
Yeah, so I agree with you, Victor. I think we have definitely seen more sort of well-recovered people who have had COVID and now back to normal health than those who came back in to see us because unfortunately they have had some long-term complications. And for the vast majority of them, the only effect is the tiredness and the smell that's slowly, gradually returning to them over time. There is a small group of people who had developed some complications such as long-term breathing problems and blood clots and things like that would, we have all heard from the mainstream media. I think those are minorities and those are very treatable diseases. They generally come into the emergency department and get recognized quite quickly, investigated and treated. I think in terms of the numbers and the percentage and the odds, it's quite difficult to put a finger on, say, that's 10%, 20%. But there are a number of studies that I'm aware of from a national and international efforts point of view that are looking at and examining what are the complications and what are the numbers. And I think if you go on the government website, there are quite a good information portal to say what the studies are showing and some of the symptoms that people reported as a result of long-term, possibly associated with COVID kind of symptoms and complications.
I think that's quite good. I think only about 10% of people have symptoms that last more than 4 weeks, and of those, it's only a very small percentage that go on to have long COVID. I'm very aware of time, so Neil, I think you've got our final question from the public.
Yeah, I've got another question that says, are there any exemption categories, so existing medical conditions that are advised not to have the vaccine? So I'll start with the ones that, from working in the vaccination clinic myself, that I've come across. There's very few, to be honest. It's nearly everyone's eligible for the vaccine. The ones that we're concerned about is anyone that's had an allergic reaction to anything in the past, and that's a severe allergic reaction rather than some kind of minor effect. So we'll be wary with people who've had severe allergic reactions to drugs, but certainly if they've had allergic reactions to vaccines or the flu vaccine or anything like that in the past. We're careful with ladies that are pregnant, especially in the first trimester, and that then becomes a risk-benefit discussion. Mainly, the risk is that we don't know, because as Pam was saying earlier, the data wasn't done in pregnant ladies. So maybe it's entirely safe, maybe there are problems, but it needs that risk-benefit discussion with the patient individually with the medical advisor at the time. But for me, other than that, there's very little. There gets quite a few small questions like, I'm on anticoagulants, can I not have the vaccine? But no, generally, the answer is yes, you can have the vaccine to nearly everything, apart from the anaphylaxis, and then a discussion around pregnant ladies.
I suppose the biggest group is children under 16, isn't it, for whom the vaccine's not currently recommended again because it hasn't really been tested. But yeah, I suppose if people are concerned, they should just seek the advice of their GP or healthcare practitioner, shouldn't they?
I suppose a rule of thumb is if you've had the flu vaccine, you're probably eligible to have the COVID vaccine.
So the vaccine doesn't necessarily stop you catching COVID, but it just stops you getting poorly if you do. Is that what the evidence is now showing?
Yeah, that's what the evidence is showing. So it's very much reducing bad outcomes, and by bad outcomes I mean getting really sick such that you need intensive care, or the worst case scenario if this life is at risk. So the vaccine reduces the severity is what the evidence is telling us. We still don't know if it stops you being a carrier, so that's another concern. So we still don't know if you can potentially still carry the virus and infect other people although you've been vaccinated. That's a little unknown that needs a bit of clarity, which hopefully in the fullness of time we will understand better.
Yeah, I mean, I think there was a study just in the last couple of days came out on the AstraZeneca vaccine that actually shows that it does reduce transmission rate. Probably doesn't stop it, but reduce it. So it's looking very positive from the vaccine.
I think you've got a linked question to that, haven't you, Victor?
Yes, I do. So the next question is, if we're able to choose a vaccine we receive, do any of them carry a higher risk of reactions or side effects?
I'll kickstart on this one. Actually, there's quite a common question that people, when they're attending to the A&E in the emergency care center, is one of those, just the one more thing, doctor, I got this question. And it has been quite a frequent question that people ask as they are leaving the consultation. So I think the general explanation I give to people is to explain the basic science of the vaccine is to generate an immune response so that the body remembers the virus, and then the next time there is a virus coming close to you, your body's already ready to fight off the virus before you get severely infected. And so the vaccine itself is not an active virus and therefore doesn't actually cause you the disease. It just helps your body to recognize what may be coming. So although there may be different vaccines and work in slightly different mechanism, the outcome is exactly the same to the body. And so there is no additional risk, whichever vaccines that you are getting, because you're still getting that immune response to the virus and for the body to recognize in a long time to come. So and that's my general explanation to people. I appreciate it's probably quite wordy and geeky from me. So I don't know if anyone else got any other way they would explain.
I've not heard anything significant that would split me to choose one vaccine over the other. I'd have whichever was in stock.
Yeah, I agree. I agree.
Maybe I think you've got a question for us all.
Yeah. So the next question is, with the flu vaccine that we have a new vaccine every year, do you think this will be the same with the COVID vaccine, that we will get a new one every year?
I would have thought probably. I know they've done studies now that show that people that have had COVID have reasonable antibody levels, certainly at 12 weeks and probably at 6 months. The problem with all of this is we're only really a year in, so we're going to be overwhelmed with COVID data over the next 5 years. I would have thought it'll be papers and papers and papers, and we'll learn more. And it may turn out that these vaccines offer lifetime immunity. It's probably unlikely, and that we'll need boosters and we'll need yearly changes. And it may even be a bit like the flu vaccine, where it's not the same vaccine each year. It's changed dependent on the most common variants that are around the world. It's altered, and then you get that year's COVID vaccine. So it may be that we do need it going forward.
Yeah, no, I agree with you, Neil. And once we've got the system in place for delivering the vaccine, then it becomes less of a burden to the health system, because it becomes business as usual, so to speak, as we roll out of the crisis pandemic mode into normal delivery of vaccines on a yearly basis. I
agree. Neil, I think you've got a question.
An undated document released by the Scientific Advisory Group for Emergency SAGE found that vaccine hesitancy was highest in the BAME community. Why do we think it is? And do you think that the BAME community is right to be hesitant?
That's a great question. And
you don't have to answer this, Victor.
I'm a vested interest in this one. So just to put some data on the question, I think it's a great question. I looked up the latest poll from the Royal Society of Public Health actually this morning, where they polled 2,000 odd people. The figures are, 76% of folks in total would be willing to have the jab, and when they broke it down, you then had 57% of BAME likely to accept the jab. So we're looking at the difference between 76 and 57%. Complex reasons. You talk to different people and they all have different reasons. Previous bad experiences with authorities, hospitals, deep-rooted suspicions, tales passed on from generation to generation. So there's these issues, psychosocial issues that have to be overcome. But I think if more people from the BAME background, I mean, I've had my jab and I'm really happy. I'm going to push my mother when her time comes to have her jab. And it's just reassuring friends, family that, this is safe. There isn't a hidden agenda. This is for our benefit. When the time comes, when the letter comes, when the phone rings, please go and get your jab. It is safe.
Yeah, I agree, Victor. I think we have quite a lot of discussion within our work groups about this, having read the news and other forum discussion. I think a lot of them is to do with education and information spread. And I think sometimes people in certain community groups that perhaps not get the equal amount of access to information and education as other communities. And I think simple reassurance would just will convince them to have the vaccine, as opposed to they didn't want to have the vaccine, full stop. So yeah.
That's great, thank you. Neil. Oh no, sorry, not Neil. It's me. I've got a question. Do you think, so I think we've all had our vaccine, our second doses delayed. I think that's all our experiences by varying amounts. Are we still confident that the vaccine, if there's a 12-week gap, that the vaccine's still going to be as effective? I know the evidence is changing all the time on this, but what are our current feelings?
I read quite early on a good article from an immunologist, like very clever guy, who was looking at the way other vaccines react and measuring antibody levels. And first of all, the reason why everyone's saying we should have it within 2 to 3 weeks is because that's what they did in the trial. It's not that we know that it's any better or any worse than any other length of time. And he actually worked out that around about 10 to 12 weeks is when you gain the most benefit from the second jab in terms of boosting your immunity to whatever it is you want boosting to, in this case COVID, and also long-term keeping the immunity. And that's research from other vaccines. So I don't see why this vaccine should behave any differently. So I think essentially we don't know, but certainly having read that, I'm not concerned. And this recent study that came out a couple of days ago shows that actually at 12 weeks, people are having good antibody titers from a first dose. So it seems to be backing up the science seems to be backing up the government's position.
Yeah, no, I agree, Neil. And I think that just reinforces that although you've had your first jab, you can't just go out and do normal things. That just, your first jab doesn't suddenly give you this freedom. You still have to be careful, get the second jab, and then wait for a large percentage of the community to get the full vaccine before we can actually start to think about how we live our lives again. And actually, so that actually brings home those very important social points that we talked about earlier on.
I completely agree. I think protecting as many people as possible with that first jab is the right way to go. It is difficult, I know, and I can see that there's arguments, but yeah, the more people we can get vaccinated with that one jab first, the safer we will all be. And like you say, it does emphasise those social messages as well, that this is a slow, we will emerge slowly from this. We still need to be really careful. So it sounds like everybody's experience has been pretty positive of vaccination and supporting the vaccination programme. Is that fair to say?
Yeah, I would agree.
Yeah,
Sorry,
definitely.
Neil.
Sorry, Neil. Go ahead.
Oh, no, I was only just going to say, it was on the new variants that the same immunologist had a good point on the new variants and whether the vaccines would work. And he said, from looking at other vaccines, it's likely that there would be still protective effect against the new variants. And he put it really nicely. He said it's like the vaccine's got to help your body recognise the invading organism and treat it. And he said, so if it's like recognising your best friend, if your best friend put a cap on, you'd still know it was your best friend, but it looks slightly different. So that's how he was kind of explaining the new variant. So you'd still, your body will still know it's there, still know to kill it from the vaccine, but it's just slightly different.
That's great. I love that. Okay, thank you very much, everybody. That's been a really useful discussion. Thank you so much.
Oh,
Thank you very much.